afternoon. So myself, Emma Tippett, naturopath, and
Vanita Dahia.
We are joining you today to have a little bit of a chat about sleep. Now, sleep is a huge issue for a lot of Australians. So up to 40% of Australians have trouble with their sleep, quality sleep and falling asleep. Up to 32% of young adults 18 to 24 years of age actually have a lot of trouble falling asleep. And chronic sleep deprivation or insomnia can actually double the risk of depression.
Wow, that's quite significant, isn't it?
It really is. So what we wanted to chat to you a little bit today is some things that you might want to consider to help to improve your ability to fall asleep and your quality of sleep. So I wanted to ask Vanita today, what sort of tests or things can we think about to help people to improve their sleep?
I guess the first thing we need to find out is there a problem getting off to sleep, or is there a problem maintaining sleep? So if there's a problem getting off to sleep, then it is important for us to be aware that we can actually measure melatonin, which is a hormone that is made by the pineal gland in the brain to actually get us off into a pattern of sleep. But often, most people have a problem with maintaining sleep, and they often get up because they have to go to the loo, or they just get up because they are thinking about all the woes and sorrows for the next day.
That's right.
So in that case, we actually measure GABA, which is a neurotransmitter, which allows us to actually sleep longer. It's also a neurotransmitter that helps us manage anxiety and worry and the rumination of the same thoughts, etc. as well. So really, those are the two major things. But unfortunately, people who have, as Emma just said, chronic insomnia doubles the risk of depression. So guess where our melatonin comes from? It actually comes from serotonin. So often we would need to actually measure both the serotonin and the GABA levels to identify neurotransmission pathways as well as the sleep deprivation in association with melatonin.
So it's in our modern way of living, in our modern society, stress is a huge issue, and stress is going to, chronic stress or engaging that fight or flight response every day is obviously potentially going to have an impact on our balance of neurotransmitters. So when we can understand where the levels of those things are for you, then we can help to address some of the underlying causes, maybe looking at your stress, your adrenal function, but also obviously in the short term, helping our bodies to produce more of those neurotransmitters, maybe providing the building blocks for them.
Yeah, and the key is identifying the underlying causes that actually drive it. If you're under a lot of stress, cortisol will go up and melatonin will come down. So so we can definitely identify these things using validated testing. And Emma will introduce to you some of the test reports that are available, and we do have access to performing these tests as well.
That's right. So we use a lot of these types of things in the clinic. So in terms of our practice, very evidence-based and trying to really understand what's going on with the biochemical pathways in your body, so that when we are prescribing herbs or supplements, that we're actually using the right things for you to correct some of those imbalances. So we are actually going to link some of those sample reports, the PDFs, and if that's something that interests you, if you would like to understand a little bit more about what's going on in your body at this level, then you can actually book a 10-minute phone chat to speak to us about that.
Which is totally free.
That's right, it's complimentary. And we can discuss further some of that testing for you.
Have a look at the link below.
Thanks, guys. Bye.